myotones. So remember in the cervical spine, we did muscle testing of specific muscles in order to make sure that there's no neurological weakness, okay? So remember, neurological weakness is not a one-time weakness, it's a fatigable weakness. So as we test that muscle group through, say, 5 or 6 repetitions, or over a 5 or 6 second period, we will notice more weakness. So it's like the muscle is fatiguing, okay? So we're going to start off with the L2, which is your hip flexion. I'm going to do it all on this side here just for my convenience, so I don't wreck my back. So L2 is hip flexion, all right? So what you're going to do is just hold your leg right there, don't let me push it down. And we can hold it for that 5 or 6 seconds, or we can do 1, 2, 3, 4, 5, 6, okay? So that's L2. L3, knee extension. So what I like to do, you can do these in sitting. I'll run through them quickly in sitting if you prefer afterwards, but I'll do them in lying right now. Just pop your arm underneath their knee, okay, and then ask them to hold their foot up, all right? And again, 1, 2, 3, 4, 5, 6, and she doesn't have teeth, okay, so that's all good there.
I'm a good faker on the bottom.
It's fine, you're doing very good. I'll make sure I use the same ones today. Sometimes I switch these out and do stuff. Okay. So pulling the feet up is L4. Okay, so don't let me pull your feet down. And again, here I can compare, I can do both at the same time, so it's nice and convenient, right? So I'm just repeated testing there. I've got these out of order for some reason on the sheet that I noticed when I looked through it again last night, and I went, why didn't I put L4 and then L5? L5 is big toe extension, okay? So don't let me pull you down. 1, 2, 3, 4, 5. She's good there. S1, turning the feet out. Okay, so taking the feet into eversion, I usually place them there and then say, hold that position. Don't let me turn them in. 1, 2, 3, 4, 5, 6. Okay? And then S1 and S2 are, don't let me straighten your knee. So we're using knee flexion or your hamstrings. Okay? 3, 4, 5. Okay? So, and again, we would do these on both sides to compare one side to the other for general strength, but more for fatigability, and that's the important thing. Can I quickly run through them in sitting? Are you guys okay with that? Because sometimes sitting, the difference between sitting and lying is if you suspect a disc problem, if the person can sit okay, I would like to do them in sitting. Do you guys know why?
Well, it's obviously a different muscle isn't being used, but this one maybe takes up that.
What did we say about standing and walking versus sitting? Flexion and extension positions. What's the difference? Which structures are being more...
The disc.
Working at this point?
Disc is being more compressed in sitting, so if we suspect even a mild disc problem, sometimes if it's really mild, test them in sitting, because then you're going to be compressing the disc at the same time as you're testing the nerve roots, okay? So you might get more information. If you test them in lying and they have a disc problem, you may not pick it up. So it's just a subtle difference. Again, it's kind of that fine-tuning thing. If you guys just test them in lying, that's fine, whatever you're comfortable with, okay? But again, we can do it the same kind of thing here. So in sitting, just lift your leg up off the bed slightly, hold there, don't let me push down, 1, 2, 3, 4, 5, okay? You can do L3, don't let me push your foot backwards, 1, 2, 3, 4, 5, okay? Pull your, pull your foot up, don't let me push down, 1, 2, 3, 4, 5. Big toe up, don't let me push down, 1, 2, 3, 4, 5. Turn your foot out, 1, 2, 3, 4, 5. Pull your leg back, 1, 2, 3, 4, 5. Okay, so we've done L2 hip flexion, L3 knee extension, L4 foot dorsiflexion, L5 big toe extension, S1 turning your foot out into eversion, S1-2 pulling the leg backwards into knee flexion. Okay, so again, you can do them sitting or lying, your choice, but again, it's just that fine tuning between the disc and other structures that you may get. All right. So the dermatomes, obviously we can't quite really test them on Rhonda, but we can run through them. So L1 would be doing And again, this may not be appropriate. You may ask the patient to do it to themselves. Okay. Again, if you can do it, if you know it's the same sex person, you might be able to do that a little easier. Take the Kleenex, and if you notice on your notes here, L1 kind of runs along the side of the flank, basically. Okay, lateral hip. L2 is also kind of in that same area, but generally a little bit more in through the back area, okay? And then it also runs into the inside of the thigh. So again, it's a kind of a weird area. If you use the Kleenex, you're very professional about it, make sure the patient's draped properly, you'll be okay testing, all right?
Not forget your feather.
Yeah, exactly. Not a feather. Not a good idea. Oh boy. Okay, L3 tends to run down along the inside of the knee. So if I'm going to test L3, I'll run down here. L4 will tend to bring us a little bit more over the knee area. Okay, so the front of the thigh and the knee. And it comes down, L4 will come down into the big toe as well. So sometimes I'll just even test around the big toe area, especially if they're having just foot pain. Okay, you can test around the big toe area. L5 is more down the side, so it may be a little bit in the back and generally down the side of the foot, okay, side of the calf and side of the foot. S1 tends to be more all the way down the back and into the sole of the foot, okay, so more along the outside. S2 also involves the heel. S1 and S2 are the bottom of the heel. Okay. So again, use that Kleenex and just compare one side to the other. Does it feel the same on both sides? Okay, last one that's specific to the lumbar spine is the prone knee test. So lie down your side facing this way. The prone knee test, now with the straight leg raise test, we tested the sciatic nerve. There's two major nerves that supply sensation muscle power down into the leg. The other is the femoral nerve. It often gets forgotten because it's not as compromised usually because it's higher up in the lumbar spine, so it's not as stressed. Okay, the nerves come from higher up. But we still want to be able to stretch it. So say, for example, she was having some symptoms on this right side of radiating pain down into the front of her thigh, maybe L3, L4. Okay? So what we're going to do is try and stretch that femoral nerve. So I want her to take the bottom leg and bend it up. And she's got her head forward already, so that's all nice. I'm going to take the top leg and I'm going to pull it back in a flexion position. Now, if you just do this, she's going to move all over the place. So stabilize at the hip, okay? And then pull her back carefully. Again, what we're looking for is a recreation of pain. She's probably going to get some stretch pain in the quads. That's a normal thing, okay? And if you're finding that you're getting a positive and you don't know whether it's a stretch pain there, A, you can compare it to the other side, but you may be tight on the other side as well, okay? B is you can have her straighten her head back. So if she brings her head back, we've taken the pressure off of the system, and if I repeat that and it's not as bad anymore, then we go, oh, it's probably more nerve. Okay, so that would go along with, say, radiating pain into the front of the thigh or the inner thigh. Okay. All right. Time to take a break and.